Today we are going to be showing you how to measure the active range of motion for shoulder flexion, extension, abduction, internal rotation, and external rotation. First off, we'll start with shoulder flexion. We're going to use a goniometer and have our patient sitting in a chair with feet on floor and having good posture. The axis of the goniometer will be 1 inch below the acromion process. We're going to start with arms hanging down at side, movable arm along humerus, fixed arm pointed at the floor. We're going to have our patient keep arms straight and raise forward overhead as high as possible. The fixed arm stays in place and movable arm with the humerus. The shoulder flexion should measure up to 180 degrees. Second, we are going to be showing you how to measure the extension of a shoulder. Again, we are going to put our axis of the goniometer 1 inch below the acromion process and have our patient sitting in the chair with feet on the floor and good posture. We're going to start with the arms hanging at the side. Now we are going to have our patient keep arms straight and extend as far back as possible. The shoulder extension should measure up to 60 degrees.
Yeah, 60.
Third, we will be showing you how to measure the abduction of a shoulder. We're going to be measuring from behind to avoid breast tissue. We're going to have our patient sitting in a chair, feet on floor with good posture, and the axis of the goniometer on posterior glenohumeral joint. We're going to have our patient abduct arm to side of body as high as possible with hands facing forward. The fixed arm stays pointed to the floor, movable arm moves with lateral humerus. This should measure up to 180 degrees. Fourth, we will be showing you how to measure the shoulder internal rotation. With our patient sitting in a chair, feet on floor with good posture, we're going to have her move her humerus parallel to the floor and arm bent at a 90-degree angle. The axis of the goniometer on the electronom process with fixed arm at floor. We're going to have our individual keep humerus parallel to floor as they rotate forearm down to floor. Fixed arm stays pointed to the floor and movable arm moves with ulna. This can be done with gunslinger position for gravity eliminated. This should measure to 70 degrees. Okay, fifth and lastly, we will be showing you how to measure the shoulder external rotation. We're going to have our patient move their arm humerus parallel to the floor and arm bent at a 90-degree angle. The axis of the goniometer on the electronom process. We're going to have our individual keep their humerus parallel to the floor as they rotate forearm towards the sky. This can be done in gunslinger position for gravity eliminated. This should measure up to 90 degrees.